Introducing the Scoreflex Dual Wire Balloon from Orbis Niche, a global pioneer in the provision of life-changing vascular solutions. Scoreflex is a focused force dilatation balloon that comes with a dual wire system that creates a focal stress pattern in a very localized area. This is the ideal balloon for controlled lesion preparation. Scoreflex is a dual wire system. The first wire, the integral wire of the Scoreflex system, is mounted from the distal tip to the proximal end of the balloon. This wire is made of nitinol. The second wire, the 0.014-inch guide wire, runs on a mini rail system to where the exit port is distal to the balloon. During balloon inflation, the two wires create focal pressure onto the plaque on the vessel wall. As stated in the instructions for use, a step-up inflation is recommended for optimal lesion dilatation. The expansion planes along the plaque resulting from the Scoreflex dual wire balloon are clearly visible. Scoreflex offers effective controlled dilatation unlike a conventional balloon. This makes Scoreflex ideal for lesion preparation, particularly for drug-eluting balloons, stents, and scaffolds. Scoreflex is also ideal for lesion preparation in ostial lesions, bifurcation lesions, long diffuse diseased lesions, in-stent restenosis, small vessel lesions. Scoreflex, the ideal balloon for effective controlled lesion preparation due to its low crossing profile and beatable trackability and less vascular injury compared to non-compliant balloons. Lesion preparation matters. For more information, visit www.orbisniche.com.
I would describe Orbis Niche as an innovative company that is really and truly dedicated to improving health outcomes in the patients.
I think Orbis Niche has done a good job. They have found a new way of improving these stents, and that is by putting the antibody 34, CD34 on the surface of the stent, which allows healing. So they are unique in that. Then they're also being unique that they're doing a large number of big studies. So they're not afraid. They know their technology. They are not afraid to take the next step and see that it actually comes to fruition.
The boldness that it takes to be where they are today, where Combo is today, and what the future that Combo faces is really pretty unique in the medical device industry.
Orbis Niche is a very innovative company which already 10 years ago decided to move into a direction to adapt this EPC capturing technology to clinical interventional cardiology.
I'm highly confident with the innovative, the creativity, and the progressive nature of the company in terms of developing products that are going to be safer and effective for our patients.
I would say that Orbis Niche means innovation.
The AnsCare Chitoclot pad is indicated for bleeding control after artery intervention surgery. It is made from freeze-drying hydrophilic chitosan, and its uniform porous structure enables excellent blood absorbability. Combine Chitoclot pad with a sterile gauze roll. Prior to sheath removal, withdraw the sheath 2 to 3 centimeters. Apply the Chitoclot pad to cover both skin and vascular access site. Gently remove the end section of the sheath in a parallel to forearm direction. At the same time, apply pressure with the thumb on the arterial puncture site. Continuously apply pressure for 3 to 4 minutes. Fix the dressing with the elastic bandage. Then, the radial artery hemostasis procedure is complete. Prior to sheath removal, monitor the activated clotting time, ACT. When the ACT is less than 250 seconds, withdraw the sheath 2 to 3 centimeters. Check the position of the arterial puncture site with the fingers. Remove the sheath in a parallel to leg direction and quickly apply pressure to arterial puncture site at the same time. Clean the area of the skin incision site. Place Chitoclot pad with sterile gauze pad over the skin incision site. Gradually release proximal pressure to permit a small amount of blood to contact the Chitoclot pad. Then quickly apply pressure on both the arterial puncture site and the skin incision site with both hands. After 5 to 7 minutes, slowly release pressure to confirm that hemostasis has been achieved. If no bleeding occurs, leave the Chitoclot pad on the skin incision area. Apply a sterile gauze roll over the arterial puncture site, then tightly wrap pad and the gauze roll. Finally, apply a medical sandbag to deliver pressure continuously. The hemostasis procedure is then complete. AnsCare Chitoclot artery compression device is designed for bleeding management after radial artery intervention. Novel combination of compression device and chitosan hemostatic dressing significantly reduces the hemostasis operating time. Before hemostatic process, withdraw the sheath 2 to 3 centimeters. Apply chitosan hemostatic dressing to cover both skin and vascular access site. Align the 1/3 point of chitosan hemostatic dressing to the skin incision site. Wind around the wrist with flannel band. Tighten flannel band on fixing plate by attaching the black Velcro to the flannel band. Withdraw the sheath in a parallel to leg direction and quickly apply pressure with the device to stop bleeding. Keep rotating the knob counterclockwise till the top of the knob meets the top of the rotating core. AnsCare Chitoclot artery compression device provides appropriate pressure to stop bleeding and maintain blood circulation. According to the patient's condition, after 30 minutes to 1 hour, release the pressure by rotating the knob counterclockwise 1 full turn. And release the pressure knob completely 1 to 2 hours after applying the compression device. If no bleeding occurs after 2 minutes of observation, remove the compression device. Leave chitosan dressing on the skin on incision area. Finally, cover the chitosan dressing with a sterile waterproof dressing or bandage to fix it in place. The hemostatic process is complete. Care Chitoclot artery compression device is designed for bleeding management after femoral artery intervention. Novel combination of compression device and chitosan hemostatic dressing significantly reduces the hemostasis operating time. First, adjust the angle of the compression plate. Rotate the knob clockwise 2 full turns to adjust the pressure plate about 30 degrees. Then rotate the knob counterclockwise to keep it still. Pull the femoral artery catheter out 2 to 3 centimeters. Ensure the short flannel band is placed on the inner side of the right thigh and pressure plate parallel to the artery. Silicone pressure mat targeting the puncture site of femoral artery. After rotating the thigh from the inner side, fix the short flannel band to the black Velcro. After rotating waist from patient's dorsal side to abdominal side, fix the long flannel band to the black Velcro. The remaining length of the flannel band can be adjusted as needed. Make sure the flannel band is properly fixed to the thigh. Rotate the knob clockwise 1 full turn to confirm the knob is working. Withdraw the sheath in a parallel to leg direction and quickly apply pressure with the device to stop bleeding. Keep rotating the knob clockwise to the end until there's no bleeding from the puncture site. After 1 hour, release pressure by rotating knob counterclockwise 1 to 1.5 turns. According to the patient's condition, release pressure knob completely 2 to 4 hours after applying the compression device. If no bleeding occurs after 2 minutes of observation, remove the compression device and leave chitosan dressing on the skin in incision area. Finally, cover the chitosan dressing with a sterile waterproof dressing or bandage to fix it in place. The hemostatic process is complete.